On behalf of the Area Agency on Aging of Pasco-Pinellas, I welcome you to Aging on the Suncoast. The Medicare open enrollment or annual election period is a critical time for Medicare beneficiaries to review their Medicare coverage, and to assist in this process, free, confidential, and objective counseling is available to these Medicare beneficiaries, their caregivers, and family members through our SHINE program. For over 19 years, the Department of Elder Affairs SHINE volunteer counselors have provided this essential counseling service, empowering Florida's older and disabled citizens to understand and maximize their health care benefits. On today's program, we have two guests to tell us more about SHINE and Medicare. Janet Mills is the SHINE Area Coordinator for Pasco and Pinellas County, and Charles Franckle is the Local Area Coordinator for Pinellas County. Welcome to Aging on the Suncoast. Thank you for taking time during this busy time of the year to join us and share information with our audience.
Pleasure to be here.
Janet, I briefly described SHINE, but tell us some more about this program.
Yes, it was originally started by Medicare because Medicare doesn't have any offices to help people locally with their Medicare and other health insurance questions, and it's all run by volunteers in the state of Florida. We have over 450 volunteers in the state of Florida and just about 60 volunteers in Pinellas and Pasco County. And they go through a training program, and they are mentored, and we really try to provide the quality answers that often are not readily available otherwise.
Medicare can be so complicated. Even the most intelligent person who has dealt with a lot of business matters in the past may have questions, and especially if you're transitioning into Medicare, it's a whole new language and a lot to learn. So SHINE volunteers are available to...
The SHINE program provides free, unbiased counseling. Nobody in our program should ever tell you what to do, but should hopefully educate you, and you can make your own best choices.
Excellent. And SHINE stands for Serving Health Insurance Needs of Elders.
Correct.
But in reality, SHINE can assist a person of any age who has Medicare.
That is correct.
Good. Charles, share with us some of the types of assistance that SHINE counselors can provide.
Sure. Well, right now we're coming into what's the annual enrollment period, where people can change plans if they're already in Medicare. You can only do this once a year for your, especially if you have a drug plan or an Advantage plan. So if you have questions and need help researching the plans, looking for drug plans you want to change, whatever, we can give you comparisons. We usually use the Medicare.gov website, which is a great source of information. We can help you use it yourself, or we can do it for you and help you compare the plans. As Janet said, without saying this is the plan for you. We will never do that.
Right. And it isn't true that there's like one good plan or one bad plan. What might be a good plan for you might be a bad plan for me, because we have different needs. You work to get this information from people about what their needs are.
Absolutely. And, what your circumstances are determine. The other thing that determines it, and one reason we can't tell you what the best plan is, we don't know what's going to happen in the future. And which plan's best for you may end up being, hopefully it will meet your needs, but there may have been something better.
Right.
And you want to make sure that you contact your doctors to see what your choices are, to see what plans that they're contracted with.
If we're talking about an Advantage plan now, especially HMOs or PPOs, which are available for Medicare participants, yes, one of the most important things you can do is narrow down the list of plans, because there's so many of them, by finding out which ones your doctors take.
Okay, so that's a place to start even now before the annual enrollment period, is to talk with your doctors about what plans they're going to be participating in the future. And we talked about the annual enrollment period. Tell us the time period that it covers.
It will be October 15th through December 7th, and the effective date for the change is January 1st.
Okay, so any person can make changes in their Part D plans during that period of time, the Part D covering the prescription drugs.
Even people that never had a prescription drug plan who may now choose to enroll, they can do it then, and only during that October 15th through December 7th time.
And what other changes can be made during that time, Janet?
You can change your Medicare Advantage plan. You could go back to original Medicare. You can add a supplement if you wished. that pays the other 20% of what original Medicare doesn't pay, although that isn't necessarily tied into the annual enrollment period. But yes.
Okay, so, and I understand that the Shine counselors will be equipped with the information they need around October 6th to help.
We have been told that on October 6th, all the new information will be available on Medicare.gov, which, as I mentioned, is our source for most of the information we use.
And it's updated every year because there can be significant changes in the plans?
That's why everybody should review their plan at this time of year. If you're already in a plan, they should have sent you information about their changes, but they change what drugs they cover, their formularies. They change their co-pays. There may be changes in the providers that are in the plan. So there are some important changes that all the plans make, and it's worth reviewing every year.
So you can't sit back and say, oh, I've been happy with X, Y, Z. I'm going to continue. I should stop and check with my doctor to make sure he or she is going to still be in that plan, and then look at the plan to see if they've made changes in the benefits of it, as well as are they still going to cover the drugs that I...
Yes. Now, someone may have gotten information from their plan already and said, that's fine, I'm happy with it.
Okay.
Fine. If you don't do anything, you'll stay in that plan. But if you really want to nitpick, you could say, well, other plans have changed too. Maybe there's something better now. But that's your choice.
When you talk about formularies, we're talking about this is what the particular company has said that they will cover for prescription drugs.
For prescription drugs.
And so if someone is calling Shine, they should have a list of their drugs that they take.
Exactly the way they take it. How many times a day and how many milligrams. And if they take the generic drug, then that's what they would give us, that information. Or the brand name. That really facilitates things if they have that list ready to give to us.
Okay, so this is also a good time if you're going into your doctor to talk with them about is there a less expensive way to take this medication? Could I be switching to a generic? Okay, lots to think about. This is such valuable information, and you know there's so much information out there during the annual enrollment period, and much of it comes from the insurance companies, which is helpful, but they are selling a product, and it may be good for one person again, but not for another person. And the Shine counselor takes the time to look at all of the plans.
Yeah, you're going to be bombarded with advertisements from all the plans because it can be a profitable business. There are agents trying to sell it, and sometimes they're very knowledgeable. But the thing about Shine is we have no interest in selling you a particular plan. We are unbiased. We will help you compare all the plans that are available. So we say finding your doctors helps just narrow that down, that choice.
Okay. You've mentioned Medicare.gov, which is a very important website, and we're going to run that information in the graphics of the program, as well as the Shine website. For the state of Florida operates, which gives information if people are internet savvy and want to look that up themselves. But we also will run the 1-800-96-ELDER, our senior helpline telephone number, because that's how someone gets in touch with a Shine counselor, isn't it?
That is most of them come that way, yes.
Okay. And generally they call in.
And they can leave their name and number and what their concern is. At the telephone line. They do not have to wait if it's a busy time to wait to speak with an intake person. They will take that information and then it will be provided to a Shine counselor and we will return your call.
Okay, and it may be several days before a Shine counselor gets back to them.
It could, right. We try to get to everybody in 1 to 3 days, but sometimes during the enrollment. And if you can tell us when it's a good time to reach you, that is terribly helpful.
And I have to say, our Shine volunteers, every annual election period, have gotten back to all of the callers. We just have a phenomenal group of volunteers. And you all were recognized by the state of Florida last year when you went. There's an annual meeting every year, and our volunteers were selected as the Volunteers of the Year for the state of Florida. Just in terms of the quantity of information you give and the quality of service that you provide. So I congratulate you. You two are the leaders of that team, and you have an excellent team. Let's talk some, if I'm a viewer, I'm thinking, this is complicated information. How do these people know all this stuff? What prepares them, Charles, to be a volunteer?
That's one of the things as a volunteer that makes it attractive. You're always learning. So we don't always have the answer, but we will try to find it if we don't. But we start off with, I believe it's a 3-day basic training now, in which there is a counselors from the state who will come or trainers who will give this course with the material. After you pass the exams in that, then you are mentored by one of the senior counselors in your area. And you do a minimum of 6 sessions doing that, and more if necessary. So, you have to have a decision between the mentor and the mentee that you're ready to go out and do this. Then there's continuous training during the year, whether it's quarterly meetings, annual meetings, special training that's available. So, and then just your own personal research. People get a lot out of that.
Well, and so often I find with the volunteers that work out of our office, they're huddled in a room thinking through a problem. You all seem to enjoy something that's peculiar or makes you think or do some research. So no volunteer is left on their own to solve problems. If it's beyond their knowledge, they have resources within the SHINE program to figure out what is.
Correct. And we encourage all volunteers to take on whatever problems there are and seek the help to do it, not just hand it off to someone else.
Okay, but there's always that backup.
Absolutely.
Because you are helping people with some of their most important decisions, and that is creating access to health care for them. And it is complicated.
Right, and we are all very HIPAA compliant. We have been federally fingerprinted in order to be part of this program. So although we may discuss a problem, no one's personal information ever enters into that discussion.
Okay.
We're very privacy concerned.
And that is so important when we are discussing medical information about prescription drugs. Our SHINE counselors generally work 5 days a week during business hours, and that is when our senior helpline is open, so that individuals can call during that period of time and ask for assistance. Are there other things that our viewing audience should be thinking of as they approach the annual enrollment period in terms of making decisions? We've talked about checking with your doctor, writing your list of medications. Is there other information that they should have on hand if they're going to be talking with a SHINE volunteer?
Well, during that same annual enrollment period, there are people that are new to Medicare. So we are of great assistance to people. Some people are still working and have concerns about evaluating their employer, keeping their employer insurance versus going on Medicare, and just learning the whole process so that they know they can make their own best decisions again. And so we spend a lot of time talking to people that are new to Medicare, because that process starts normally about 3 months before you're really going to be eligible.
And that's an important point to make. We're having this show now because it is the annual enrollment period, but SHINE is available all year round, and there are a variety of services that you offer to new enrollees as well as people who have been in the Medicare program and have run into some problems. And we'll talk a bit more about that during the second segment. But let me ask you, do you encourage people to call early on towards the beginning of October as opposed to waiting as it gets closer to December to have this discussion? You want them to start this process because oftentimes it's not just a matter of one conversation, is it?
Exactly.
That they have to do some research, and it's such an important decision that they should be taking time to make it.
That's very important. And then we can talk later about presentations that are given in various areas of Pinellas and Pasco counties, which are very educational for people to attend if they want to learn more about their health insurance options that way.
Okay. That's a good way to begin a discussion and begin the thought process, and we'll find that some of those will be published in the newspaper, but if any of our audience is interested, they can call the helpline, can't they?
Right, and I believe that they're on the SHINE, or going to be on the SHINE website.
Excellent. Okay, well, we're going to take a break now, but we'll come back and talk. I'd like to talk a bit more about the volunteer opportunity as well as the other services that SHINE provides throughout the year.
Look, here's a charge for something we didn't order. Good catch.
I don't think you should ever pay for any bill unless you have first made sure that all the charges are correct.
Speaking of which, have you heard of the latest Medicare scams? This happened to my friend. A man came to her door claiming he was from Medicare. He had a smooth line about helping seniors with the high cost of their medicines, but she had to give him her Medicare number right then before the deadline. Well, when she got her Medicare summary notice, it was full of charges for services she hadn't received. Turns out this guy was a scam artist.
Medicare already has everyone's number. They wouldn't need to ask for it.
Scams like these hurt every taxpayer, draining billions from Medicare and making it harder for people like us to get the health benefits we're entitled to. So I did something about it. I joined the Senior Medicare Patrol, where I work with other volunteers to teach my neighbors how to protect their Medicare numbers, review statements to spot false charges and detect errors, and report suspected fraud.
During the first segment, we have been discussing the SHINE program that assists Medicare beneficiaries to make informed decisions about Medicare and other health insurance issues. Rejoining us for this segment is Charles Franckle, the local area coordinator of the SHINE program, and Janet Mills, who is the SHINE area coordinator. During this segment, we will learn more about SHINE and the importance of volunteers to the SHINE program. When we ended the first segment, we were talking about there being presentations out in the community and for our viewers to be watching for those or to check the SHINE website. Much of the counseling is done over the phone. It's not necessary for a person to be seen face to face. But there are some outreach sites in the communities where someone can go actually sit down and talk with someone face to face?
Yes, and those are done by appointment.
Okay.
And the senior helpline can provide where the closest site for someone to go to make an appointment is. Then we will get back to them. Then the person at the site will get back to them and verify the appointment with them.
Okay, and again, it's important to call in early to make an appointment, and that would be our senior helpline number that we will be
Those
running.
face-to-face appointments get pretty filled up quickly during the annual enrollment time, so it's good to really think ahead.
Okay, and also to remember that a lot can be handled over the phone.
Right. Oftentimes, most of our volunteers are very personable, so that you can have ongoing conversations that might not just be a one-time phone conversation. We're available, the same person, to follow through, to answer subsequent questions. So sometimes it works as well as, or even better than, a face-to-face appointment.
Good. Good. And we had started talking too about services that are available through SHINE throughout the year. Charles, tell me some of the other things that SHINE volunteers do.
Okay, there are several things. All of them have to revolve around Medicare for the most part. If you're new to Medicare and need to enroll in Medicare, now this is not the period unless you're new to Medicare you can enroll. If you didn't when you're first available, that period is January through March.
Okay.
And people have questions about, with my employer plan, do I need to have a Part B or what should I do? So we can help them make that decision. There are also, we are not Medicaid experts, but we do deal with a lot of people who have both Medicare and Medicaid. And we can help them get that help in some cases. There are plans that work together. If they are having trouble getting their drugs, perhaps they're in the donut hole. There are things we might be able to help them with there. One of them is a Social Security program called Extra Help, or low-income subsidy, that people may be eligible for, which will help pay for their drugs and even perhaps their premiums if they have a drug plan. And we can help them enroll in that.
Excellent. And those programs where some financial assistance is being provided, eligibility can be established for those throughout the year. It's not at just a particular time. So.
Correct.
And again, by going through our senior helpline will do some screening in terms of eligibility for other programs that might be of financial assistance to the individual. So if you're going to call only one number, call the
Elder Helpline.
1-800-96-ELDER, and that may open up some doors to you. Charles mentioned the donut hole, which is that period of time when you've had coverage of your prescription drugs, you've hit a certain number, and then you're kind of on your own. For paying for them.
Called the donut hole or the gap, and thanks to the Affordable Care Act, the amount that people have to pay when they're in the donut hole has gone down. This year it's 50% only for brand name drugs and 14% for generics. Next year the government will pay 53% of the cost in the donut hole for brand name drugs and 21% for generics. And within a few years, that is scheduled to close. That gap is scheduled to close altogether. So that is really helping a lot of people.
Have you seen other changes that have impacted Medicare beneficiaries as a result of the Affordable Health Care Act?
Yes, there have been a great number of preventative services that formerly you had to pay a copay amount to get those services, and now they are free.
Okay,
so that is a wonderful thing. Things like colonoscopies. They even have obesity screenings only by the primary care doctor. Just a lot of different
mammograms and
right.
even a well visit now,
right.
without deductibles or copays.
Right.
Which is so important to have to prevent.
The idea is to prevent the greater
Yes.
expenses later on, and
Yes.
it's
excellent, excellent. We've talked quite a bit at the beginning about volunteers, and we are very fortunate to have almost 60 volunteers in Pinellas and Pasco counties who really are committed to this program. And I think when I have the opportunity to talk with volunteers, I see how important it is that they really are doing work that is of such great value to our community and to individuals, that they are gaining knowledge to really assist people, to be part of the solution to our health care issues. How does a person who is interested in volunteering, where do they start? They make a call to the senior helpline?
Yes, they can do that. That works very well. And then we have our office liaison who then gets the call and calls that person back initially. And then that person hopefully speaks with at least one other person during their screening process. They make formal application. And it's a process, and it's not for everybody, but it is a wonderful program. Charles, you probably have some things to talk about. What makes a good volunteer and a happy volunteer?
They seem to be the same thing. But it really takes someone who enjoys working with people and wants to help as a criteria. People come from a variety of backgrounds. Okay, but you need to be very good with a computer, because not only do we use the Medicare.gov website, but sometimes you're doing a lot of research just to help track down solutions to a lot of problems. You need to be dedicated, because it is going to take some time. Enjoying the learning process, that's one of the things that attracts people, I think. So on and on.
If you watch the Shine volunteers together, you can almost see this intellectual energy going on. It is a group of individuals who enjoy learning through research, learning through talking to each other, like some challenges, and have the people skills to work with individuals of all types of backgrounds.
That's right. I mean, most
abilities.
of the encounters we have are very pleasant and rewarding in themselves. But you frequently get people who have, especially some who are needing some aid or help, and they have been through the mill by the time they get to you. People don't talk to them, they can't get through to others, and so you get some people who are pretty frustrated, and usually by the time we're through talking with them, they're a little happier, but you need some patience.
Right.
What is the time commitment that a Shine volunteer should expect?
Well, the program says that you will spend at least 16 hours a month, but basically you will find that the tip of your iceberg because of the learning process that's involved, as well as helping people. So basically, if you were to become a Shine volunteer, we try to give trainings 4 times a year, and maybe after 2.5 months you may have finished with the mentoring process. However, then you have to solidify your knowledge.
Right.
So it takes 6 months to a year in most cases for people to really be able to work independently. And I will make mention of the fact that if you are here, that doesn't mean you, as a retiree, you can't have a holiday, but if you live here year-round and can have some sort of a year-round commitment, not just live here 6 months, it works much better for this program because of all the intricacies involved.
Right. Right, to
Yeah,
keep
there
that
are some people who
education going.
successfully are snowbirds, but it takes a different commitment because if you're away from it for 6 months, it really is difficult to come back and jump right in. So you need to at least be active during the time you're away and continue that learning.
And we are able to reimburse volunteers for their mileage when they are traveling into the office or to do a
Yeah.
presentation. But beyond that, what are the rewards of this? Both of you have been doing it for a number of years. You are leaders, organizing our volunteers, and you mentor the volunteers. So you've seen them evolve. What do you find that people see as rewarding from what they are doing?
I think what Charles mentioned, the satisfaction of actually helping someone, and even though they may be a difficult client, that frustrated person, you have really, really helped them to get where they needed to go in terms of their information and help. Also, we do have an annual meeting, which is a 2-day learning symposium, which is very valuable, and we have constant learning via emails and other printed materials. We have quarterly meetings, which one really needs to attend, which are day-long sessions with all kinds of learning programs involved in them. Can you think of anything?
Well, I was just going to say, sometimes it's hard to enumerate all the things we get out of it, but a lot of our volunteers are like myself. We're retired, and we have a large choice of things we can do. And so I'm in a fortunate position, where if I don't enjoy doing it and feel satisfaction from doing it, I don't have to do it. And so I can't enumerate all the reasons why.
But you keep coming back.
I keep coming back.
You keep coming back. And hopefully, someone who calls in who does have an interest will spend time with either Sue Sampson, our liaison, or with one of the two of you, talking about, you know, what qualities they can bring to the program, what it is that they want to get out of the program. I know a number of individuals have been helped themselves, either dealing with their own Medicare situation or a relative's Medicare situation, and they've said, wow, you know, I can't believe how helpful those folks have been. I want to be one of them.
Which, if I may, you brought up something that's not always the Medicare person themselves, but sometimes their children or helpers or others that we work with. So I don't want people, if you don't have Medicare yourself, we're still glad to work with you if you're helping someone who does.
A very good point, a very good point. And, you know, I have to thank the both of you. You have chosen not only to, both of you do a lot of counseling. I think we looked at last year, and our Pasco and Pinellas volunteers helped over 13,000 people over a year's span. So, and you two are very much a part of that, both in what you do personally, but in training other individuals to do it. So you're evidence that there is good to this program, both from the volunteer point as well as for callers. And I thank you for being here today, and I thank our audience for joining us. I hope you have written down the telephone number and will call our helpline if you are in need of some assistance.
You're watching PCC TV, Pinellas County Connection Television, a division of Pinellas County Communications.